When I heard Hui Yi told me she wants to be a nurse, I have the impression that she only change diapers, carry patients, and she's a princess at home. That's worry me.
Mommy,
Yeah.
I don't just change diapers.
Oh.
Hi, my name is Hui Yi. I graduated from the National University of Singapore in 2013 with a degree in nursing. I'm currently working in a special care nursery at KK Women's and Children's Hospital. Here at the special care nursery, we take care of babies who are acutely ill or require special attention. Some cases that we take care of include babies who are born less than 1.5 kg, and the normal average size for a baby is about 3 kg. And we also take care of babies who are born premature. I remember on my first day in the special care nursery, there was a baby I wanted to attend to who was crying. However, she was approximately less than a kg at that point, and she was in an incubator. I was so nervous at that point that I didn't dare to even touch her. I had to seek help from my senior, and I was quite amazed by how expertly she was handling the baby. So today, I'm able to teach parents baby care. I teach them how to feed their baby through the feeding tube, how to insert the feeding tube, as well as to bathe these fragile babies. And I also teach parents blood sugar monitoring for babies who are going home for safe management. I'm also able to pick out subtle signs that could indicate a deterioration, and we alert the doctor about it so that they can take appropriate measures. Over the years, I've learned to multitask. So there can be many people talking to you at the same time, and you hear so many things at one go, but you need to focus on the task at hand. So I'm currently involved in research work that mainly revolves around hyperinsulinemic hypoglycemia, which is a syndrome that's causing low blood sugar level in babies. And I plan to pursue a master's degree in either education or management in the near future. I also enjoy my time outside work. I do yoga 2 to 3 times a week, read as well as walk my dog, Chihuahua. He's called Oscar. I find that all this is necessary for me to keep a healthy and balanced life. Seeing the babies get well enough for discharge, seeing their parents grow in confidence in the care for their babies, these are all the little rewards I get from my job. It's all the little things.
I'm proud of her.
Mommy, I'm still your princess.
Yeah, forever.
People ask me if it's really like what they see on TV. Well, sort of. When a patient is called in, let's say a young biker in a road accident, we'll all be on standby. Once we receive the patient, we check his vital signs, assess the extent of injury, arrest bleeding, immobilize limbs, and prepare for operation if required. If there's a traumatic arrest, we'll do resuscitation. It's quite unpredictable, so you need to think and work on the go. You become good at problem solving on the spot. With a good team, everyone knows their roles and what to do. CPR, adrenaline, shock. We work as equals here. I know it is stressful, but you will have that sense of achievement. Other rewarding parts are connecting with patients within a short time, knowing what their concerns are, to assure them that they will be taken care of. As for perceptions of males in nursing, honestly, that didn't affect me. Now that I'm a nurse, I realize that there are a lot more guys in emergency department. Maybe it's because it's faster paced and more muscle work, like heavy lifting of patients. Those who enjoy the adrenaline rush and thinking on your feet in high pressure and unpredictable situations will enjoy emergency work. Oh, it helps if you like meeting and working with different people, because we work with different colleagues on our shifts. By the way, I met my wife in nursing school at NUS.
Hi, I'm Ashley. I am also a nurse.
I didn't expect to find a partner who would understand what my workday would be like.
I think the best part is that we're both nurses and we both understand what each other is feeling. I've seen him change over the years. He used to be messy, but now he's more organized.
Yeah, my room is a bit messy, but I know where everything is. I'm more of a freestyle person, but as a nurse, I've become more organized. You make sure everything is in place, nothing's missed out. I've become a bit OCD.
I think the toughest part is that when we are on different shifts, we don't get to meet much, but we do work it out.
One of the perks of being on night shift is that we get days off on weekdays, so we don't have to squeeze the crowd when we go in Park Hall. So yeah, that's nice.
With so many temptations these days, I know it can be hard to go on a zero sugar diet. As a nurse clinician specializing in diabetes care, I tell everyone, especially my friends, to take less sugar, adjust your habit a bit, take a bite just to get a taste, and share the rest.
They have no changing for about more than 6 years. She can be quite naggy with her advice sometimes.
I also encourage them to exercise more because it's not enough just to watch their diet. At the hospital, I used to see many middle-aged patients as diabetes is a chronic condition that usually affects those 40 and older. Nowadays, more young people are also getting it due to unhealthy lifestyles. I encounter different types of patients. I have very easy ones who agree with what I say and pick up what I teach them and make lifestyle adjustments. There are also those who are quite stubborn. They rebut me or reject my advice. I learn to listen, be patient, and put myself in their shoes. It is hard for some of them to accept that they may need insulin injections for life. I'll give them some time and then come back to tell them about the benefits of why they need to be on insulin now. For those who are fearful of needles, I will hold their hand reassuringly and show them how to inject the insulin for the first time. This will give them some confidence. When I was younger, I wanted to be an actress or a teacher. Now I do see myself as a teacher too. I teach patients and their family members how to manage their condition. I also teach the new nurses and public about diabetes prevention and management. When I first started, I felt so tired having to talk non-stop to so many people. Now it's a lot easier. I really enjoy patient education. It's very fulfilling to see my patients manage their condition better. So far, of all the areas I have worked in my 20 years of nursing, diabetes care is the one I find the most satisfying.
Chào anh, ni hao ma, chào bao lo meyo. In community nursing, patients that I see are mostly elderly people, so they are not able to speak and understand English. I have to pick up a bit of Mandarin here and there, and some of them even teach me dialects, which is nice because I develop a relationship. I have this one uncle who has a lot of padlocks on his front gate, so I will joke around with him and say, "Uncle, do you know what? I always have to wait for 5 minutes for you to unlock all these padlocks." So he giggled and mentioned to me, "You always like to disturb me, Hannes." So I'm very glad that I make his day happy. Most elderly patients, they prefer to be cared for in their home environment rather in a hospital. So in community nursing, I think it's in demand now because of the silver generation. We visit them to see how they progress. We check whether their family members are able to cope and manage the patient's condition. We even check their medication and do skin assessment if they have any wounds. Our nursing services include insertion of nasogastric tube, change of urinary catheter, wound dressing, and also change of stoma bag. So we go there monthly to change the feeding tube or catheter depending on what catheter or tube they are using. In community nursing, we see the social and physical environment for the patients to recover. So if I see the patient's home in a mess or the caregiver is stressed, I will bring the case up during multidisciplinary rounds, which include a team of doctors and medical social workers. Honestly, nursing wasn't my top option as a career. I wasn't too sure what it takes to be a nurse, but with the advice and encouragement from my mom, I continue with nursing till today.
Kecil-kecil orangnya ceria, dia kelakar juga, tapi kadang-kadang dia kalang kabut.
I wanted to give up halfway, but she told me to, just pursue with nursing. There's no need for you to look any further. You got nursing for a reason, so just embrace it.
Yang dikejar tak dapat, yang digendong keciciran.
My parents are not getting any younger. I am the next in line to care for them. My dad has gotten sick. He actually complained of severe back pain last year. And the first thing that I had in mind was renal-related issue. So I refer him to a urologist, and truly enough, he had kidney stones. I do feel a sense of accomplishment. I'm really glad that with the nursing skills and knowledge that I have, I'm able to help my loved ones with their health-related issues.
In this world, we all have limited time. Some of us know when the time is up, whereas some of us don't. But what is most important is to make the best meaning out of the time that we have. As advanced practice nurse in palliative care, I see patients with end-stage illnesses. Palliative care is basically the care that is given to patients with life-limiting illnesses to improve their quality of life. So I help to manage patients with their pain and also see patients at the day care clinic at HCA Hospice Care. So when I first started, my friends were like, "Why did you go into palliative care? It's so sad." And that over time also made me feel very sad. But somehow it all changed with this encounter with a doctor who was also a mentor. It was the change in perspective that brought a deeper meaning to the work that I do. One of the things that she shared was that palliative care is not about dying. It is about living meaningfully with whatever remaining time that you have. And once I saw the meaning in the work that I do, I saw greater value in all the things that I was doing for the patient and the family. I fondly remember an elderly man. He was actually in his 90s and he was living alone. During one of the visits, he told me, "Kavita, is it alright if I have a meal with you?" I was surprised with the request because we are there to provide clinical care and not to have meals with our patients. But for this man, I had to make that exception. He probably had not had that meal with anyone for many years. So I said yes. And we had a very good meal together. A few days later, our dear gentle elderly man had a fall at home and he landed up in the hospital, and subsequently after a few days he passed on. Most of my patients, they tend to reevaluate a lot of things at this point of their life. The conversations that I have with these patients also get me to reevaluate my own values, my principles and my morals, so that I can reshape my thinking and bring a different perspective to my life. This has also got me not to take things for granted, even the simple things such as spending time with family. One of the visits that I'll always remember was my visit to this young mom. We were helping to control her pain. So once she was a bit more comfortable, she held out her hand. The moment I touched her hand, I felt the warmness. That warmness I will never forget because it reminded me of my late mom. My patients have taught me so much. I see how strong they can be dealing with whatever hardships they're going through, and that truly inspires me.